Hi, I'm here today to talk about what I am taking. I take probiotics, vitamin D, vitamin B12, fish oil, vitamin C, and like I said before, I drink a lot of ginger tea to help with my stomach because it's known to be a relaxer, like a natural muscle, like relaxer for your stomach. I also want to talk about the symptoms that I get. A lot of my symptoms, I get really bad headaches, tension headaches in my neck and my back, and my arms are numb, pain in my arms. Like I've seen other people say that it feels like somebody's pulling on their arms, and then like all of a sudden it'll just be a pain out of nowhere. Anywhere on your body, not just your arms, but I do have a lot of neck issues. I do have degenerative disc disease, and they do say I don't have any pinched nerves. So I guess it's a lot of the myofascial pain that I'm dealing with, which I've been being told for a couple of years now. So I'm dealing with that, along with a lot of the tender points for fibromyalgia is in the elbows and the knees and the feet. I learned that, just pressing on the areas help a lot to release whatever's being released. I'm not even sure, but it helps me as far as if I'm having a pain like on my elbow or my knee. I will kind of just press for a minute and try to release some of what's going on in there. Another thing is your toes. My toes, when I crunch them up, it hurts. So I do, some of that. I do the stretching of the toes, and also when I did go to acupuncture, I don't go anymore because of insurance reasons, and that's another thing that I can get into later on about insurances and why they don't cover alternative medicine. But so basically, those stretching and just moving the joints I find helps. But some days I just will sit there and just cry because I don't know what to do. But I do get through the day, and every day is different but the same. The pain can travel and be in different spots every day. I used to be able to do yoga. I tried doing it one time and I kind of got aggravated because I realized that I wasn't in, my muscles are really tight. And, I do try to do some, as much as I can as far as, because you have to keep moving. If you don't move, then it's just going to get worse. I know that's easier said than done. I have the type of tired, anxious days, like every day. I have anxiety when I wake up, panic attacks when I wake up in the morning. So, just getting out of bed is hard sometimes. So, I think that was, my feet. I talked about that. What I wanted to say too was what I have tried for medicines. I did try Cymbalta. I'm all set with that. It made me really dizzy, and my doctor did say it could have been because it could have lowered my blood pressure more than it should have. And a lot of times when you take Cymbalta, I know it works because I have a couple friends that are actually on it. I know a couple people, acquaintances that are on that, and sometimes it can cause anxiety because it's can make it be a stimulant with the antidepressant. And when you have fibromyalgia, I was explained by my doctor that it can become it can increase anxiety, and if you have anxiety already. So that's one thing that I learned did not work for me. as far as others, I mean, it did actually work for like the pain, but the dizziness I couldn't handle it. I couldn't do it. And being on medicine, I actually get anxiety taking medications, so it's hard. But you know, those are some of the things that work for me. Heat, I use a lot. I use a lot of heat. I have a heating pad. I have heat. You know, moist heat I put on. But I live basically with my heating pad every night, or you know, during the day. So you know, heat does help a lot, and I don't know what that music was, but whatever. I think it's probably one of my other things I have running on here. I do use topical like gel. I use these actually. If you can see it, yeah. I use these. I mean, they're very minty. But you know, and they are hard to get off too, so beware. But I do use those. Sometimes the smell can kind of make me sick. I mean, I can get headaches really easy. I do get migraines. So you know, those are a few of the things that I have been working with, and I just wanted to give you an update on some of the things that I have been doing for my fibromyalgia. I have a lot more to say, but I'm going to leave this for now, and we'll see you soon. And keep coming back to my videos, because I have a lot to say, and a lot of information. And please leave comments about, you know, if you have any input, or if you would like any questions answered. Thanks. Bye-bye.